Welcome to At the Nurses Station, a podcast for nurses about everything but the patients. Sam and I are here on a Tuesday midday. It is boiling hot out, like 95 degrees. Sam, you were helping out at VBS, right?
Oh, yeah, it's VBS week, and I am again assigned to the preschoolers.
That sounds horrible.
I'm happy to help serve my church and my community. I every year request to be in the snack department, and there's like this misunderstanding that I'm good with children because I have them and work in pediatrics, and you know as well as I do that I am not. So, yeah.
Yeah.
I know it's good. It's good. I work with it's good. It's good.
It's whatever. Good. Well, I have a funny story for you. So I was at work last night, and do you ever have those days at work where so much life happens at your house while you're not there, and you're just like on the outside, just like watching this like whole saga unfold through texts and phone calls?
Oh, no, my kids aren't as old as your kids, maybe.
Oh, and they probably leave you alone.
Well, they don't have phones, so yeah.
So yesterday I was at work, and it starts by me getting a video of a stray cat. And the boys saying, "Can we please keep it? Please, please, please." And this is like an emaciated, horrible looking black cat. And I was like, do not let that cat inside, because we have 3 cats already. That was going to, be the worst. And I knew my husband would have a heart attack. So anyways, they keep sending me pictures and all this stuff. I'm like, it's fine. You can feed the cat because it's dying, obviously, but don't let it inside. I just kept saying that. So then I wait until my break, and it's now 6:30, and I know my husband's home. So I call him. I'm like, "Hey, how's the new cat?" And he was livid. He was like, "They called me before they called you. I told them not to feed that cat, and then they went and called you, and meh, meh, meh." And he was so upset. So I'm like, "Well, I'm sorry. How's the cat?" And he's like, "Well, the cat looks like it's almost dead. So it is probably a good thing that we fed it." Fast track to like an hour and a half later, my husband has now sent me pictures of the cat because he's hanging out with it outside. And my husband has named it and said that he's keeping it. So now everybody's in love with this cat. I haven't even met it yet. I come home at midnight like I always do, and I wake up, the cat ran away. It's not even here anymore. So now the kids are all upset because Steve, the cat, is missing. I'm like, he's not missing. He was never ours. He was a stray cat that showed up, and you guys decided to keep it.
And you prolonged its misery for like another 24 hours.
Yeah. And it's probably a coyote's food now. But
yeah.
So anyways, it was just kind of funny just watching all of that unfold while I was at work. And I never met the damn cat.
Oh, yeah. That has not happened to me, but I feel that. Yeah. Wanting to be at home when everything's going down, or just having you're like, I have no idea what you're talking about. I don't, what is that? Like the people that feel like we live in a sim, and you're like, these are the times that I feel like the sim is real.
Yeah. Yeah. Or you're getting like multiple sides from like different
people.
Oh,
yes.
And your husband's telling you one thing, your kids are saying another thing, and then whatever. And it's like, I'm not even there. Like, this is not even real world to me. This is just entertainment.
Else. No, sadly, we do not have any more kitty cats. So
if I find Steve, you can have him.
No, thank you.
Well, it's horrible because they were telling me all this. So then I got on Amazon and ordered like worm medication and flea medication. Because I'm like, okay, if I go home and there's this cat here, then I'm going to have to treat it because I don't want my other animals to get sick. So now I have like $100 worth of cat medicine for a cat that doesn't even live here.
Return. You probably can't return that stuff, huh?
I think you can.
Yeah. Oh, well, I'm sorry. And then you have to go back tonight, huh? Or today?
Yeah. As soon as we're done recording, I'm off.
Well, good. Maybe our conversation today will help you be a better nurse then.
Yeah.
Maybe. We were going to talk a little bit about some of the skills that we find most enjoyable and also least enjoyable maybe, and maybe most valuable. Because I think some of them are, oh gosh, what do they call those? Soft skills in
Ooh.
HR. Yeah, I hate that.
What would be an example of a soft skill?
I work well with others
Oh, bleh.
or whatever. I don't know. I think those are like soft skills. Like you're good at writing emails, which no one even needs to write an email anymore. You just dump it into AI and are like, respond to this in 2 paragraphs with 4 sentences each in a light, poppy, feminine voice.
Oh my gosh. I actually just applied for another job.
Okay.
Well, just as a side job.
Okay.
So one of our local hospitals has an amazing forensic team to do sexual assault exams.
Oh,
Mm.
okay. Okay.
They have a PRN position and you only
Mhm.
have to be available 3 shifts a month, like 3 12-hour shifts a month.
Mhm.
Um, but they offer really amazing training and all of that stuff. So I was
Yeah.
like, well, I could do that. And I had to redo my cover letter and yeah, AI to the rescue. I mean,
Mhm.
I was like, I don't want to write this. And so hopefully my new hiring manager isn't listening to this, but that was AI written.
I think they all
With
are.
just a little bit of tweaking here and there. I was like, that was way better than I could have done in 30 seconds.
You, what would I call you? Are like an equal opportunity job applier
Hmm.
for, I don't know how, I'm not sure of a good analogy since you kind of put me on the spot with this, but I think since I've known you, you've applied for many, many positions.
Yeah, I just throw it out there.
Yeah,
And
you
then
sure do.
and then if it comes back and they want me, which of course they do. No.
Of course they do.
I'm like, "Meh, I'm good where I'm at."
Exact. Every time a shift becomes available and people are like, "Oh, who's gonna apply for that? Oh, nobody wants that." I'm like, "Kelly will apply.
Yeah.
Kelly's gonna apply for that shift. She doesn't want it and she would hate it, but she's gonna apply for it."
Yeah, I like to have my options open.
Fair enough.
Yeah, I'm one of those weirdos that went from a part-time day shift back to full-time nights because I was like, "I miss my night shift people." And then as soon as I was back on there, I was like, "This was a horrible choice."
Which I think the exact opposite. I did the opposite. I went from a full-time night shift to Monday through Friday, 9 to 5, and I was like, "This is the worst decision," from
Oh,
home even,
yeah.
and I was like, "This is the worst decision I ever made.
Yeah.
Can't function like this." No. Well, writing a resume is a good skill to have for sure. In nursing, it doesn't really matter, I don't think.
Mm,
There are other things that are better. Like, should we just start with our favorite or should
yeah.
we mess around a little bit?
No, I think we go top, which
Top
I think
down.
I think are both of ours are the same, right?
Yeah.
IVs.
Yes, thank you.
Every time.
I don't know, is IO your favorite now? I mean,
Oh, it was
been
so great.
yeah, cracking femurs.
But I don't know that you can do something once and then make it your favorite. Like, what if the next time it doesn't go so well?
Okay. Okay, that's fair. We'll
Yeah.
put we'll put it like a option 0.
Yeah.
Okay.
No, I mean, yesterday I put an IV in a real chronic oncology kid.
Mm.
And when you walk in and the parents are like, they normally need an ultrasound. And I'm like, well, I'll give it a shot. And then you just put it in.
Oh,
That's just amazing feeling.
man, does that feel so good.
Hmm.
That okay, so we don't like our goal is not to talk bedside necessarily. Things that I love about IV starting, physical things I like about IV starting, when the skin is like butter and it just goes through like soft butter, and when there's a pop and
Mm,
when there's like a drag for my catheter, when like
mm.
the vein like pulls it right in. Those are my favorite things about.
Yeah, tough skin, like when you're going through like elephant hide, that's not fun
No.
because then you can't really feel what you're doing.
Mhm.
And sometimes it's like threading a needle in the dark. You're like, it's there somewhere. But that's also a good, like, I also like that when you're not exactly sure where it is, but you know your landmarks and you
Mhm.
know it's somewhere in this like centimeter diameter
Mhm.
radius, maybe, whatever that is.
Sure.
Anyways, and so you kind of go in and then you just like change your angle little by little and then you just hit it and it's like, "Ooh,
Mm.
I knew it was there." That's
Okay,
kind of
are
cool.
you visual or tactile?
Oh, tactile.
Really?
Yeah. I
Okay.
mean, visual to a point. Like baby IVs, I love my little wee light.
Mhm.
To shine, for those who don't know, you shine a light underneath the hand or underneath the wrist or to the side so you can see through the skin. That then I'm definitely visual, but like when you can feel the vein, I'm going for where I can feel it.
I honestly can't decide which one. I think that like the best IV starters are tactile, but I found that if I can, even on grown-ups, I'm like, if I can see a shadow, I can usually get it. And I just go keep going down until
Yeah.
I hit it because something's there. So I'm gonna hit something. But my mom was always like, I just don't, all I need to do is feel it. I don't need to look at it at all. I'm like, well, then I might just be like a really crappy IV starter working at like the top of my capabilities. But if I don't need to feel anything. If I can see just something. But
Yeah,
once you're,
but
uh-huh.
you're a flicker. You're a flicker to so that you can so do you flick so you can see or flick so you can feel?
Oh, see, I guess that's what, yeah, the rubbing and the flicking to make it stand up. I actually, that, gosh, it's like so, you know how it's like so second nature and like all of your senses are kind of working at the same time. I actually want it to stand up because it takes the poke better.
Mm,
So it sort of just helps me decide which vein I want, or
mhm,
it will show me a vein, but it's not necessarily so that I can feel it.
mhm,
Like I'm not looking for it to be feelable. It just like doing all of that will just make it bigger and stand up better, and then it will take the catheter better.
yeah.
Um, but
I have to throw this out here because Sam taught me something, because
oh,
I haven't done adults in, a millennia, and, we had a very, overweight woman one time, and we could not find a vein, and Sam showed me how to put a vein or put an IV in the boob.
yeah.
So,
Shout out to one Jennifer
explain.
L out there in the world. You'll know who you are because you taught me how to do this. So you call it a boob vein, but it's not. It's more like just below the clavicle, maybe, or like kind of in that no man's land in the chest. And you just lift them up and tip them backwards, and you get somebody to hold. You're kind of like tourniqueting it with someone's hand, sort of by the sternum, but you're also really holding tension because that skin is so loose and
Are you going
movable.
up or down?
You're
Like,
going
up
you
towards the clavicle or down towards the nipple?
so usually that vein is not running like north and south,
Mm,
right? It's running left and right. So you catch it towards the armpit and go towards the sternum. I
mm.
don't know, can you see mine? I have it goes like right here.
Uh-huh.
Dink. But they're so shallow and the skin is so soft and it feels so good. And they're usually like 22s at least. Sometimes I don't know that I've ever gotten, I feel like I've gotten a 20, but you could put a heat pack on it if you wanted to get it hot. And then you just have somebody come in there and like spread it out real thick, real tight for you and hold a little bit of pressure. And it'll just like you can watch it because
Mhm.
it's so shallow.
Yeah, it's like putting a scalp vein in,
Yes, but not as
but there's no bone under it.
well. And the skin is softer. That
Yeah.
was the thing with the scalp vein is you gotta,
Yeah, pop it
um,
through.
but yes, you taught me the scalp vein. The other thing, if you have a large patient, is 2 tourniquets. That came from my mother. And not like one above the other, just like put them in your hand together and you tie them at the same time.
Mm.
2 tourniquets.
Have
Yeah.
you I have seen or heard people do a tourniquet above and a tourniquet below. Have you ever done that? That
Like
doesn't really make sense to me.
the site, above and below
Yeah,
the site? No, I've never
yeah.
heard or seen that.
Somebody was
Although
talking about that, and I was just like, "That doesn't." I mean, I guess you're trapping the blood there, but the tourniquet below just doesn't really make sense to me.
so one of our nurses was talking about a special type of block that they do to reset a fracture where they put lidocaine distal to the fracture and a tourniquet, um, like what's the other word I'm looking for? Medial to the fracture? Um,
Yeah, we've done that twice, I think, recently because we have some new doctors that are, I think it's called a bone block. I don't know. Somebody will correct me on that. But I guess they do it on adults way more.
Sounded weird to me. But anyway, no, I've never seen a tourniquet above and below. I've seen like where you use gravity instead of a tourniquet. What's the other thing that I like? Also from one Jennifer, she taught me on like little old women, especially, or
Mhm.
little old people that have like really mobile skin and mobile veins. You go in at the bifurcation,
Mm.
like you hit the vein at the Y, because they're more stable there. And so then you go up from there. And that has served me well.
Well,
So
and another tip is sometimes not using a tourniquet at all on those dehydrated kids because their veins are like so fragile. So sometimes I have not used a tourniquet and had more success.
I've heard that, and I've got to be honest with you, I have not ever had success in kids not using a tourniquet.
Really?
In little old women, yes,
Mm.
but in kids, and I put that tourniquet on super tight.
Yeah.
I love a good tourniquet, but that's you also do the sticky on the hand.
Oh yeah. Yeah. So the prep swab, I think is what it's actually called, but it's the sticky swab. I coat my whole glove in it, and then I clean where I'm gonna poke, but everywhere else around it and the kid's hand and everything I cover in stickiness so that we're stuck together.
But if they're gonna rip their hand out from you, that's not gonna save you. It's not that sticky.
Oh, it is though. Like, because those kids will sweat, and if you have that sticky on, they won't sweat the sticky off.
So it just like stops the slip.
Yes.
That
Yeah.
I haven't managed to add that step, but I see you do it, and I see another nurse do it as well that we work with.
Yeah.
That's a really good IV starter. When we were talking about this the other day, I don't think she'll listen to us ever, so it'll be funny if she hears this. But one of our nurses, who's a great IV starter, she just gets on a roll though, and just needles are coming out of I don't even know where. Because she like stays in the same place, holding the foot or the hand or whatever she's working on. And it's usually like a really hard stick or something.
Mhm.
She'll miss another needle out of somewhere, goes again, misses another needle out, and it is just like this.
I I have done that though. I mean, especially if you're looking at the hand or the foot and there's like 3 veins right
Yeah,
next to each other. And it's now I'm not advocating for everyone to do this. If you like can generally 95% of the
yeah,
time get an IV, then if you poke twice and missed it, then just poke a third time. Because if you like already know and it's right there and you're already holding, I'll do the same thing. Like
yeah,
just hand me another needle. Damn it.
yeah.
I'll get it.
It's just such a funny thing to watch, and they're usually like critical kids or sick kids or
Yeah.
chronic kids, so so it's not like just an everyday, and everybody's already crying because you're already set up and doing stuff,
Yeah.
but it always just cracks me up when I'm in the room or holding for that. I'm like, oh, this is the mode we're in rapid fire.
Love it.
Cracks
Love
me up.
it.
So yeah, I've been trying your little thing. Oh my gosh, you're gonna have to help me. Where you put
Oh,
the AccuFill? What's
yeah.
that?
Yeah. The Accutainer. Is that what
Yeah,
it's called?
I did it for a little while and then I didn't like it anymore. So
Well, you tried it. I don't do
I
it on
did.
everyone,
I did it
but
on I think I did it back to back on like below 6-month ACs that I started.
mm,
And it did pretty okay. And I was like, well, I might be convinced. And then I always grabbed the wrong one.
yeah.
So it doesn't connect. And it's a deal. Things that irritate me about
Mhm.
other people's IV starting. I'll let
Okay.
you go first.
Oh, um, if it is the most critical kid and you don't have strong
Mm.
IV skills, it's okay to bow out before you walk in the room.
Oh, okay.
Um, and that is not to say that like that's hmm. So if you're a newer nurse and you just need some more practice, I get it. You want to try on those really critical kids, but like we have one kid, he's there all the time. He screams at the top of his lungs every time he's poked. He just doesn't really have any good coping skills, and he's a really, really hard poke. Like that's not the one to go in there and try 2 pokes on.
Mm, yeah.
It's okay to be like, hey, I'm going to grab so and so who
Mm,
like will have the best chance. And that's for the kids' sake. That's not saying anything against you.
mm. Okay.
Um I guess that would be my biggest thing.
That's not at all where I was going with this, but that's
Oh,
good. That's good to know.
okay.
No, that's totally fine. I'm with you.
Well, you tell me, where do you wanna go?
I was gonna say it really irritates me when people put the no-nos on and then put the hub and the clamp under the no-no so that to literally do anything with the child, you have to take the whole no-no off and
Yes, and
then
I will say I have been guilty of that because
Mhm,
I didn't know, like, the great trick of the no-no and then the netting and all of that stuff,
mhm.
but I do know that now.
Yeah. That probably pisses me off the most because 'cause I'm like, "What's the point of this now? I just have to undo it all of the time," which risks the line, so let's see, what are some of the things that I've encountered? I once, took care of a patient that was getting blood in the ER, got a report, went to check on them, and found that the tourniquet was still on their bicep while they were
Whoops!
getting blood. Yeah, so that was a fun one. That was
To be fair, I'm sure that they were very embarrassed that they left a tourniquet on, whoever that
Yeah.
nurse was.
Yeah, that was not at our facility, but yeah, I remember thinking not really what would you say? Not really, nice thoughts about that nurse for a very long time. I'm like,
Sure.
I don't like, "You're a dum dum. Ew, you're dumb."
And the
Uh,
patient obviously wasn't with it enough to complain.
yeah, I don't even remember if he had ever said if he said anything at all to me. Yeah, I don't know. You've started art lines, yeah?
Oh, by accident,
By
yes,
accident, yeah.
many times. Um, mostly when I was in NICU, and
Mhm.
scalp veins, because there's well, scalp veins, and I think I probably did hit a radial every once in a while, but it's hard to hit a radial if you're not
Wait, I'm
going for
sorry,
it.
there are arteries running on the outside of the scalp or, like, on the outside of the skull under the scalp?
Oh, oh, yeah, and they're right next to where, I have taught you, but you can see and feel the,
Shut up, I have taught you. Stop it.
no, I mean, they're right next to where I have taught you where to go. They're right
Oh,
on the, medial side, like, above the ear, like, where that one good vein
uh-huh,
runs. There's
uh-huh.
a artery right next to it, but you'll know right when you hit it.
Well, I mean, I know that part. I guess I never noticed that it was I don't ever remember feeling a pulse in any of those.
Yeah, but that's why I'm saying, like, usually it was in NICU because the babies are so tiny, everything is
Mm,
obviously, like, right next to each other, so
yeah.
and, yeah, you just pull it and hold pressure and
Oh,
move
so
on.
you say you'll know when you hit it, but I feel like I've hit an art line myself once, an
Mm.
artery, and then, like, just a little while ago, I was holding and a nurse hit one, and I feel like most of us are like, "Is that an artery? Do you think that's an artery?"
Well, it's bright red blood, it's pulsatile,
I
and
know.
when you flush, that this is the biggest thing is when you flush, it blanches. So you will see a big white, splotch where the catheter ends. So if you're in an artery, you will like flush it and all the skin will go bright white.
Even in the AC?
I think so.
Hmm. Do you have something else? Go ahead.
No, I was just gonna say we should move
I
to
That's exact
a different skill because we're going to just talk about IVs for an hour.
Yeah.
Okay, so what about I mean, I guess a lot of people don't like to do caths, but
Oh.
urine caths on little kids or babies, that's sometimes satisfying too because not they're a little bit more difficult, right?
Which I
They're
I
not difficult for
guess
me.
I
Oh.
don't understand what's difficult about them personally. It's not the only and I wouldn't even say tripped up, but I would say there's probably been like 3 times in my career where a teeny tiny little uncircumcised penis, the little hole in the foreskin, I just cannot get to line up with the hole the
Mm.
with the urethra. And
Well,
there's
and really there are like in males, there can be like a false track along that
Mm.
foreskin. So sometimes like you can put the catheter in and then you can like feel it like under the skin
Yes,
of
you
the
can.
penis, but
Yeah.
it's not like in the urethra, and that's always like weird.
I've
Um,
had 2 little girls that have had their labias fused, which I guess is like a natural thing that can happen, and so that obviously then you can't do a cath urine.
yeah, sometimes girls have weird anatomy, and like their urethra can actually be like up inside the vagina, or it can be like to the side, like
Mm.
they can be in weird places. But if you know what you're looking for, so like you what swipe and look for the wink, wink, wink. So
Well,
if you're if you're using betadine, swipe down and you just look for this little open close. That's the urethra, and you just put the catheter in there.
and with littles, you go straight down.
Mm.
But I grew up doing grown-ups, right? And like, so then when I started and like doing adults and littles because it was mixed ED, but then I went to only little. I'm like, all of your anatomy is in a beautiful straight line. This
Mm.
is way better than, either the drunk like young people or the really old people that it's all like in
Yeah.
this wiggle and you have to crawl up there and figure out where it all is. I'm like, I
No,
can
for
do
real though. It's I tell you, and I'm not the only pediatric nurse that says this. I stress out more about doing like teenage girls than I do kids, because once you have gone through puberty, like girls, like I don't know what's going on in there. There are like folds and weird skin and hanging skin and all this stuff. And I'm like, I am lost.
So you have to have them cough. That's how you get your wink back.
Oh, please
Yeah.
tell me.
You you just ask them to cough and then you
Oh.
can usually see it.
So you clean them all up and you look, and then you just like hold open
Yeah, you just
everything and
have
then
your
tell them to
hands
cough.
spread. Yeah, cough and you just kind of like you can either see like a little pee or just like right where your spot is. It's just the pressure.
If it was me, it'd be a little pee.
Yeah. Yeah.
Kelly,
Yeah.
can you just cough? Yep, there's where she's peeing from.
Okay. So my most traumatic, let's see, I've had two, I'll say my most traumatic which I love to start a Foley in our department, which I think everybody knows. Sam wants a Foley. You bring me a drunk girl or a Benadryl overdose, I want a Foley. I
Yeah.
just want to put it in, keep it clean. I was a young nurse on I'd floated to postpartum and this mom hadn't peed. And so, what is it, like 8 hours or something? Then you have to cath them. So I guess that was a straight cath. It was horrible. I mean, she just vaginally delivered a baby less than 12 hours ago. She can't pee. The husband is asleep in the room. The
Of course.
mom is crying. I am crying. The nurse that I asked to come in with me, like, can't find it. That's where I learned the coughing trick, was that whole
Mm.
episode. But I just remember like feeling so I didn't have any kids yet, but just like feeling so horrible for this woman. And in the end, we were laughing about it because her husband literally slept through the whole ordeal. But it's the middle of the night. All the lights are on bright and she's got
Oh.
her legs just spread open. And we're in there trying to find this stupid hole in this whole mess of stuff. And
Oh
just
my gosh.
so
One of
bad.
my one of my good friends, her first delivery, she hemorrhaged afterwards. And, so in postpartum, they're like pushing on her belly, scooping
Yeah.
out all the clots and all that stuff. And her husband slept through that whole thing. She was getting like transfused,
Oh,
like
jeez.
she's like dying, and he's just sleeping. I just don't understand that. Like men do better. Like that's just ridiculous.
I also started a Foley catheter on like a 90-year-old woman that had never had children. And
Oh.
that involved the very long Q-tips that we use to like, open abscesses and stuff because neither me or my charge nurse could get our hands and fingers in there because it
Oh.
was so tight and clamped down. So it was my job to hold the Q-tips to
Oh.
open everything up so that she could find the hole on this poor little just like cachectic 90-year-old woman that
Oh.
has like no mobility, so she can't open her it was
Nightmare.
an ordeal. But anyway,
Well, I do
I
have
love
to
Foley.
I have to tell the story.
Okay.
Um, and she's gonna kill me for saying this on the podcast,
Are you
but
gonna use hold on, hold on. Are you gonna use somebody's name again? Because the last time we
no,
had to cut it. Okay, good.
no,
Okay,
I'm
good.
not. I'm not. Anyways, so I was orienting a new nurse who had never worked around males before.
Oh, okay.
And so we had an overdose who could not pee and had like a liter of fluid in his bladder and was so uncomfortable. And he's
Hmm.
just this teenage boy. And and so uh, I'm like, so do you feel comfortable like doing this catheter? And well, yeah, of course. You just put it in the hole. Yep, that's all you do.
That's
So
it.
we walk in there and I'm holding this teenage boy's hand and he's in so much pain. I'm talking him through it. Poor guy has two women, in there cathing him. And she's cleaning and cleaning. And I look down and she had not pulled back the foreskin. So she's holding
Oh, jeez.
this penis covered in betadine and it's wriggling. And I'm like, honey, you have to pull the foreskin back. And she's like, oh, okay. But by this time, there's betadine everywhere. So she's trying
Yeah.
to retract the foreskin with betadine on it and on her gloves. And then she's trying to cath. And it was one of those moments where I just had to hold back the laughter so hard until we walked out of that room. And I still talk about it all the time.
With betadine all over every part of
Everything.
that
I mean,
hole.
yeah, it was
Yeah.
clean. It was
Ah.
clean. So yeah, remember to pull back foreskin. Unless it's a baby. Do
Yeah.
not
Don't do it on baby.
force foreskin to come back that doesn't want to come back ever.
Oh,
You're
yeah.
gonna rip it and it's gonna be horrible.
And
Don't do
you
that.
can be like like a little old man with prostate problems. You'll be his best friend if you just shove a tube up there. They feel so much better.
Heck yeah.
Yep. I got some free fruit once from a fruit stand because this sweet little old Hispanic man came in and his son spoke English. He's like, stop by. It's just like a regular place where we grew up. And stop by. He wants to give you some free fruit. I was like, okay, sweet. Like, this is the easiest thing I've done all day. Just pull your pants down. It's fine. Okay, NGs are good. Or sorry, Foley's, IVs. I like both of those. Cass, whatever. You are an NG fan. NGs
No.
are no.
I mean, I am fine with putting NGs down. Babies, sure. I'll do a baby all day, every day. They're so easy. But once they're mobile, I don't like them because they're horrible to place. The kids
Yeah.
hate them. Everybody hates them. They're
Yeah.
painful. They gag.
Mhm.
And then trying to tape them down is
Yeah.
a nightmare. Yeah. If
And
you're under a year old, that's fine. But older than that, no.
There's like no way to hack the NG tube. It's just, there's no, I don't know. That's what I don't like about it. Every time is different. Every time is you have lube all over your hands, but then you're still or your gloves, but you have to somehow get your stethoscope out and like plunge the air to listen and then tape it all down. But you don't want to like change your gloves because you're trying to do things quickly. And I don't, it's not my deal. But doing kids is better, I think, than doing adults because the gagging in a grown up is like I'm gagging, they're gagging. Then there's blood from the nose.
Or the worst is when you put it in and you have to kind of loop it back so it'll go down the throat, but you loop it too much and then it comes out the mouth.
Yes.
And then you got a tube hanging out the mouth that starts in the nose and then everybody's like, what is this? And then you got to pull it back and try again. And you don't like switch out tubes. You just put it right back in.
You sure do.
It's
So some things that I've seen done with NGs to make them better is curl them around your hand, right? I've seen some people warm them up so that they're more malleable. I've actually seen ER nurses dunk them in ice water to make them more firm.
Yeah, I'm like, I don't think I want it softer. When I worked in PICU and NICU, like we would put weighted tubes down and those are way easier to place because there's like a stylet. So it's not going to let it do that like flippy roll through the mouth. Yeah, the only way to do it is just freaking do it. Just shove it in and get it down. I don't listen for air. I wait till stomach contents come up and then I just tape it down. And then I'll listen, but I don't listen until it's taped.
Oh, really?
No. If there's stomach contents coming up, that's not coming from your lungs.
You don't know that?
Well, I do. I actually did intubate a kid with a G tube one time or an NG one time.
Okay.
And it was hilarious because there was a doctor and a med student watching me do it because I was just dropping it and they came in the room. And so I dropped it and the kid immediately bradyed, like heart rate to the 40s,
Oh, jeez.
like totally bageled this kid. And I was like, whoops, and pull it out. And then the doctor's like, and that's what happens if you put it down the wrong tube.
So you'll know. I have never done that
It's the
as
only time, and it was very obvious. Like
okay.
it took their breath away. I mean, you're basically intubating them, right?
Yeah.
So it took their breath away, and they bradyed, and they looked like I was killing them.
I guess that's
So,
what I'm always afraid is that I'll do it and not know. But
mm.
but I guess you'll know.
Yeah, if you had a tube through your trachea, I feel like you would make some signs.
I feel like having the NG tube anyway is so miserable that I don't know that I'd be able to tell the difference, honestly.
Mm.
I If I need an NG tube to sustain my life, that might be where I draw the limit. That might
Yeah,
be the thing that does
yeah.
me in. I don't
Do you bridle?
Oh,
That's
that's what I was gonna
relatively
ask you
new.
about. I oh my gosh, so we had this I've only ever tried to insert a bridle once, and it was an absolute failure. We have, a gentleman that comes in often who is, seizure, developmentally delayed, but, like, the size of an adult, and he had pulled his bridle and his NG, so we had to re-put it in. But at this point, he's been messing with it so much that he's also all bloody,
And
and
swollen and
he's yep, and, like, boogery, and so me and 2 other nurses went in there to do it. I tried probably, like, 2 or 3 times. The thing is, though, is that he kept sneezing.
mhm.
So he's just sneezing bloody snot just all over all 3 of us. Very sweet guy, and, like, his staff is very nice and stuff. I just felt so bad, and then another nurse that was helping, I was like, "You have to finally do it." Anyway, I've only tried 1 time. I feel like on a smaller nose, I would have done okay. I just didn't realize that passage is, like, I
Oh, it's
mean,
so far back.
so far back. And
Yeah, and
yep,
it's straight back. Like, it's not up the nares. It is straight back, like you're going towards or, like, parallel with your upper teeth, I guess is how you have to think of it. But when we first got the bridles, I was training another nurse who still works there. She's on nights, still works with us. And, we got the bridles, and I was like, "Well, let's just try putting them on each other. Like, how
no.
bad could it be?"
Dumb. Dumb.
So she's like, "Okay." And so I bridled her, and she was like, "Oh my God, this is horrible. This is horrible." And then after I had done it, I was like, "Well, now I have to let her do it to me."
That's absolutely right.
And so I laid down, and I have had a bridle placed, and it is, I will have to find the picture because we took a picture of it, and maybe we can post that on our social media. Um, because I just kept it in for a while, like it was like a nose ring.
Stop it.
And well, it was COVID time too, so we had masks, and I would just like pop my mask down and show people my cool bridle. But it was worse than a piercing. It was horrible. But the thing about the bridle, I do like it because it holds the NG so much better. But I had a physician on the floor tell me that he hates bridles because if the kid is not developmentally with it
Mhm.
enough to not pull on their tube, then they are going to pull on that bridle, which is the back of their septum, and they could actually cause a lot of damage. And I was like, "Oh, well, that makes sense." So I don't know. I'm kind of torn. I basically leave it up to the parents if they want a bridle or not. I mean, really, you should be able to replace NG tubes at home. If your kid has an NG, you need to learn how to put in an NG because that's the easiest thing. Not bring them in to get changed out all the time. But
But you can do it with a bridle, you just pop it open,
yeah, exactly.
and I mean, you leave the bridle there
Right.
and then pop right, so you wouldn't have to learn how to place a bridle, but
No, but you should know how to place an NG.
there's something about the name of it in addition to knowing what it is that I just find to be a little, like, medieval, and that's
Yeah.
the other reason that I don't like it.
Yeah.
Like, we do plenty of horrible things that taken out of context aren't great.
Yeah.
But that one, there's just something about that one,
I
so
will say it is kind of satisfying to
okay.
place a bridle because like you push it like way back there and
Uh-huh.
then you feel the click and then you pull the stylet and pull it through and it's kind of juicy, kind of fun to do, but it feels mean. Like, I mean, most of the things that we do are mean, but like a bridal, maybe because I've had it done, it feels a little more mean than like just putting an IV in.
Mm.
It's
Yeah,
pretty torturous.
I wanna feel that click. That's what I couldn't get, and I was just covered in
Yeah.
bloody snot, and then we put masks on after
Oh,
my
sure.
turn, so that was
Mm,
good. Okay, so those are some, like I mean, I'm sure that I do have, like, real opinions about how you put leads on people,
mm,
but, we are, like, getting down to time, so some of the softer skills I thought we would talk about, giving and getting report,
mhm.
and I do feel like that is a skill. I do feel like if you're a newer nurse or maybe not, but you didn't have to give report wherever you were at, finding a pattern and sticking to it. Find a script and give report with a script for like the next year.
Yeah, you and I have very different,
You don't agree with
feelings.
me on this? Oh my word.
Well, no, you have big feelings, I will say, about report, and you get a little pissy if it's not done. Like, it needs to be, "This is John Doe, who is a 5-year-old male that is here for abdominal pain," and
Yeah.
blah, 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 blah. I know. That's great. I know that, and if I give you a report, that is exactly what I will say. But I need you to know it's to appease you, because I am the kind of nurse that I'll just sit down and I'll be like, "It's fine. I'll figure it out." Like, you can tell me the highlights, like, "This kid still needs this kid still needs this. I haven't even met this kid yet, blah, blah, blah." And I'm like, "Okay, cool, bye."
Okay. If I could defend my position slightly.
Yeah, go for it.
If if report is going to be if this is like unit report, like just our shift change report, and there's no information that's going to be given, that's fine. But if you are going to give me any information, I need the context of what came before. Because if they need to go to CT or they need a line or they still need urine or we're waiting for their pain to be under control or their fever to go down or whatever, it would be nice to freaking know how old they are, if they're male or female, and what they're here for.
Sure. Yeah,
Because
basic
other
info.
well, yeah, because otherwise your information has it doesn't have any point, but it just, like, leaves more questions than it does answers, I feel like. Yeah. So,
Yeah,
yeah,
you
you're
need
right.
to know, like, what you need to do and why you need to do
Mm.
it.
Yeah. But if
Yeah.
you're like, "Oh, well, they still need to go to CT," and I don't know if they're 18 months old or 17 years old, if they're here for a head injury or abdominal pain, like, then I have to sit down and read the chart to figure these things out, in which case, don't talk to me at all because I'll just have to do it anyway. So why do both things? Just doesn't make sense.
Well, see,
Uh,
and I mean, so, like, if I'm break nurse and I'm taking over, I mean, I feel like I can take a quick look at who the patient is, why they're here, and then any orders, and I can piece it together pretty
yeah,
well. I just need to know if there's anything, like, outside of the norm, like,
agreed.
you know, "Oh, by the way, mom and dad are in there and they're divorced, and it's like a whole thing when you walk in there and blah, blah." I wanna know those things. Like,
Yeah.
set me up for success if there's gonna be some crazy social things happening when I walk in that room.
Yeah, that's true. And just for your break, well, I think that that kind of report and even shift report should be able to be done in, like, 3 sentences
Yes.
at the maximum. Like, I
Mhm.
am not asking for a dissertation. I just want very specific information in the beginning of the conversation so that I have context for everything else that you're about to tell me.
Yes, I cannot stand it when I sit down to get report and there is a saga being told to
Mhm,
me, and I'm like,
mhm,
"I don't need to know any of this,
mhm.
and what I do need to know, you have not even gotten to yet."
Yeah.
And
Yes.
that's when I probably look at you with, like, uh-huh, eyes of, like,
Yes.
"Can we get to the point, please?"
If we're venting about the patient or if it's a funny story, that's fine, but if it's actual report,
Yeah.
not helpful. Giving a report to the floor, I don't like we give report, but the rest of the hospital does not. So I don't even know, like, it's not really a thing anymore.
I know, which I actually really disagree with. I feel like ER should
Mm.
always give report to the floor or to ICU or wherever they're going.
Mhm.
When I found out that like the adult side doesn't do that, that they just write a note, that like blew my mind. Cause I don't think that that's right. I feel like you need to tell them the little ins and outs of this patient and what's been going on.
In a perfect world, I agree with you, but I feel like this is the natural consequence of the floor not taking a report. So if you don't want to take my
Mm.
phone call because you're always too busy, then you can read it. Bye.
Yeah. Well,
Yeah.
okay. Yeah, that's fair.
So as long as it doesn't jeopardize patient safety, like I don't want to not give report on a patient that, has stuff going on or whatever.
That does drive me absolutely bonkers though when I try and call a report and they're like, "Oh, I'm sorry, I'm in a room right now. Can I call you right back?" Sure. Now I end up calling them back 10 minutes later because they did not call me right back, and then
Mhm.
they don't answer their phone. So then I have to call the charge nurse, and then the charge nurse is like, "Oh, I'll find them. I'll have them call back." And we're like an hour out. And now all of a sudden it's shift change, and now they won't take the patient. And so you've had a patient sit in the ER now for at least an hour and a half that they didn't need to. And the patient is asking you why they're still sitting there. You don't have a bed to bring patients back from the lobby. And it's
Yep.
all because Sarah Jones didn't want to take report. I think we
Who
know a Sarah Jones.
we
I
do
was
know of Sarah Jones. I know. That's why I
I
was
was
like,
not
why?
talking about her at all. That was just the first like random name.
And the room's not clean and there's not a bed in the room. And you're
Ugh,
like, why is it listed as ready? It's
ugh,
not ready. Okay,
no.
but being a good report taker is
Mm,
also a skill. And that's probably where I fail because I get really frustrated if the report is not given in a way that I like or I'm not getting the information. But ideally, like you listen, let them tell you what they want to tell you. And then I guess like what I would say that I really try not to do is like be nitpicky about the questions that I ask. Like there are some things that I want to know, but if like clearly you've already talked to me for 5 minutes, that's not something that you know or that you're going to tell me. So I'll just figure it out later. So
mhm.
I don't want to make somebody look dumb or feel dumb or like
Yeah,
be
or
frustrated.
second guess what they've done.
Yeah,
You
that's a good
know, it's like, well, why did you do this? Why didn't you do it this way? Especially if it's not like a black or white situation,
yeah.
just let it go.
Or if it's a sending facility where like they're already like maybe doing something outside of their norm and then you're like, "Right, but why did you give Precedex?" "Well, I don't know."
Mhm.
"Okay, cool."
All right. Sounds great.
Whatever.
One of my favorite questions to ask is, so why are you sending them here?
No, it's so mean because that nurse didn't have anything to do with any of it.
I know, but I think it in my head a lot because I'm just like, oh, as a trauma center and as a pediatric facility, sometimes we get sent patients that like we're getting a report and we already know that we're probably going to assess them and discharge them.
That's
Um,
yeah,
that's hard.
it
It's
is
like,
hard.
oh, and you already ordered the helicopter. Okay. All right. Well, send
Yeah.
them on over, Sarah.
Poor Sarah. Ah, okay, some other things we'll hit on. I mean, we don't have to do them all. I mean, art lines is a thing I'm not super familiar with. That's more your jam. Trachs,
Mm,
way more your jam. I spent like a stint when I was pregnant with my oldest in a subacute unit
mhm.
as the nurse there, and I don't like what comes out of a trach. Give me all of the other bags, but not what comes out of a trach.
Well, what's really funny about trachs is so my son, Jack, had a trach until he was 3. So we were doing foster care, and because they know you're a nurse and a pediatric nurse, you're just going to get all the train wreck kids, like all the medically fragile ones. And I told them from the very beginning, I do not mind having medically fragile kids, but I don't want a trach. Trachs are gross. I don't want anything to do with it. And then they call me and they're like, will you go meet this little 2-month-old baby? He has a trach, but he's, blah, blah, blah. And I'm like, ugh. So then I went and met him in the hospital. And then I was like, oh, okay, I'll take you. And then I fell in love with him. And now he's my son. But I really hated trachs. But then once like I lived with a trach, you just
Mm.
kind of you end up treating it like a runny nose. Like, you
Ah,
know, your kids would sneeze and you'd grab the snot and just, that's what you do with the trach, man.
oh,
But that's why I can do anything with a trach. I recannulated him on the side of the freeway in the middle of nowhere with semi trucks going by because we were heading over that's where his team was. And he pulled his trach out in the middle of nowhere. And I just hear him. I'm going 75, hear him going, like dying. And then my other son, who was like 4 at the time, he's like, is he dying? I'm like, no. So I'm pulling over on the side of the freeway, shoving a trach in him. I mean, that's just the life I chose.
Oh, man. Well, I'm glad that he found you. That was a divine plan for sure.
Yeah, don't be scared of trachs. Trachs are easy. It's just like a nose. Just think
They're
of it
just
that way.
gross.
They are gross.
I'm a little bit afraid that they're going to pop out because I've never had to recannulate somebody like at the bedside. So that always like stresses me out just a little bit.
Yeah.
But otherwise, I'm just like, they're just.
Yeah, you just shove it in.
They're just gross.
I mean, that's really the majority of skills that we do is you just shove it in. You just put the tube in the hole, or you make a hole.
Or you make a hole. That's, yep. I need a booger. I need some pee. I need some blood.
Yeah.
Yep. Yeah. Okay. Well, those are the skills that we like. Hopefully that wasn't too bedsidey and was kind of fun. I have questions for you, but do you
I have some questions.
You do?
I was thinking about them while I was at work last night, and I wrote some of them down.
That makes me so nervous. You can go ahead.
Okay. If you got arrested with no prior warning, what would your family assume you had done?
That's an amazing question, Kelly. I don't know. I'm so nice.
Oh.
No, that's not true. I don't know.
You don't know? Yeah.
Probably made someone mad that has some sort of influence over people that arrest people, which is mostly to say that I did nothing wrong, but I've been wrongfully accused of something.
Okay.
Yeah.
So your family would assume that you were wrongfully accused because
of course
you would never do anything.
No, that probably my mouth got away from me. Yeah. And I said the wrong thing to the wrong person and am now being punished for my behavior, although I didn't do anything illegal.
Yeah.
That would be my guess. What about you?
Oh, I probably ran amok. Yeah, same.
Yeah.
For me, it would probably be like I took a protest too far or something like that.
Yeah, that sounds right. That tracks.
Said the wrong thing to the wrong agent.
Mm-hmm.
Maybe got up all in their face, or like laid down in front of a truck or something.
I would like you to know that I would come vouch for you, even though we would generally be on opposite lines of this protest. I would come and vouch for you and try to help you in whatever way I could.
I appreciate that.
Okay, what is your favorite part of a wedding?
Ooh, like the actual ceremony?
Whichever the festivities in its entirety, whether it's a free dinner or wearing a fancy dress or the vows, whatever.
No, I think it's just everybody walking down the aisle. Like the flower girl, and then the bridesmaids, and then you see the bride, and then when she kisses her dad. I think that's just really sweet. Just like the procession.
Yeah, I think that's what it's called, right? Yeah, the procession.
Oh. Yeah. How about you?
Yeah, I like I think it's the wedding dress is always my favorite part. It's just like it's the only time you get to do that.
Yeah.
And to see whatever she picked out, whoever the bride is, get just like that dressed up. I love that. And I love watching, although it doesn't happen at everyone, but when the groom like walks his parents to their seats, I always like to pay attention to what song they play.
Yeah.
And I think that's cute.
Yeah, it is. It's fun, like just watching someone's special day. Like,
and then I always look at Philip and I'm like, why didn't we do that? Why didn't you treat me like that? You don't even look at me like you love me anymore.
Poor Philip.
Do you even like me? Tell me I'm pretty.
What's the best way to get rid of hiccups?
I don't have a good way. I have 2 things that people have taught me. My neighbor says you put a pencil in your mouth and then swallow a glass of water, something about the air, I think. That has just left me with a wet shirt. So I don't know. And then I worked with a PA that said you have to put like as much air as you can in your lungs. He like had us inhale and inhale and inhale and then when we thought we couldn't inhale anymore to inhale more. So
Mm.
anyway.
That's kind of like my trick. So what I
Okay.
use for my kids is you take a big deep breath and then you hold it and you
Mhm.
hold it as long as you possibly can. And when you see their face get really, really red and they can't do it anymore, then you slowly exhale. Like you have to go.
Mm.
And then as soon as all the air is gone, you take another huge inhale and do it again.
Oh.
And
Hmm.
it's something about like the pressure on your diaphragm. This fixes it.
I don't know how much I believe all of this, like, yeah, that it's just a nerve, whatever, whatever. At least 2 out of the 3 of my boys had hiccups all of the time when I was pregnant with them. So, I don't know. Oh, it was, like, the most
Isn't
annoying.
that the weirdest feeling?
Oh, and you're just, like, rubbing on them. You're like, "Stop doing that." So annoying.
You little alien.
Okay. This one's quick. Disney or Pixar?
Mm, Disney.
Yeah.
Yeah, I like Pixar, but they're hit or miss. I feel like Disney has been up and down too. So,
Mm,
but overall I'd say Disney.
I agree with you. So,
Okay.
that's easy.
Um last one.
Okay.
Would you rather have 15 kids or no kids?
Oh, 15.
I know I really want to say no kids,
Do
but
you?
I feel like that's the logical choice.
Okay.
And I can't imagine not having kids. So,
In a different scenario, if my husband was like the breadwinner of our family and didn't love, he like loves the baby stage. He did so well with our, like, he was a
mm,
stay-at-home parent and was amazing. But if roles were reversed in some way, we would probably have 15 children. He would have let me just keep making babies until my body told me that I couldn't do it anymore. So,
well, and you had
but
an easy time doing it. So that's good. But
yes.
yeah.
Well, oh, yeah. Yes. I'm good at being pregnant. I'm not gonna go where I was gonna go. We could do that off there. Yes. Yeah, no, I like being pregnant, and having babies is just like, everyone get away from me. I need to do something really fast and I just need you to catch it. So that's that's all there is to that. Okay. Is it okay to pee and or brush your teeth in the shower?
Pee, yes. I feel like everybody pees in the shower. That's
Okay.
just I mean, you probably don't.
I do.
Do you?
Yeah. If I take a shower like first thing in the morning.
Oh, yeah. You just gotta go. Brushing teeth, though, no. I know
What?
that some people do that, but
Okay.
it weirds me out because hot water to brush your teeth seems gross. Like,
You
I just
use
want
cold water?
absolutely. Especially to rinse. Yeah.
No. I like brushing my teeth in the shower. I mean, I'm not like
Do
peeing and
you
brushing.
do you keep your toothbrush in the shower? Do you have
No,
2 separate toothbrushes?
no, I don't brush my teeth all of the time, but like if I'm gonna take a shower right before bed, or I don't know,
Mm.
sometimes because then I'll like brush my teeth for like 5 minutes, maybe.
Or you just
I just
go to town peeing and brushing?
not I knew this was a risk that you were gonna make me sound dumb. But yeah, because you can just like sit in there, you're just in the shower, it's nice and warm, no one's bothering you, get in all the places.
Mm. I
Yeah.
love a good floss. Not in the shower. That has
I
nothing to do with what we're talking about, but I really love flossing. That just makes me happy.
I don't know when the last I probably haven't flossed in like a year. I hate
Oh, it
flossing.
feels so good.
But all my cavities are between my teeth, so that's where all my
There you go. Maybe you
uh
should start to floss in the shower.
no, because then all my fillings will pop out. That's too risky for me, thank you. Okay, up next, I think in our lineup, we're gonna what are we talking about? Yes, no.
I think we were talking about the rapidly declining patient. Is that
Oh,
next,
yeah,
right?
maybe we can tell some horror stories and some
Yeah.
fun stories about the not exactly trauma, not exactly code, the thing that our epic professionals don't give us literally anywhere to chart,
Yeah.
the patient that is tanking right in front of you.
Yeah.
So, yeah.
And your last thing to worry about should be charting.
Okay, we'll talk about it later. You have to go to work.
I
So,
do have to go.
yeah. Okay, well, this is At the Nurse's Station with Kelly and Sam. Thanks for hanging with us, and we'll, talk to you guys next time.
Bye.
Hey guys, this is Kelly from At the Nurse's Station. Sam and I would like to remind you that the views and opinions expressed on this podcast are strictly our own and do not in any way reflect the position of our employers. This podcast is for entertainment purposes only and in no way should be considered medical advice. As always, consult a qualified medical provider for questions regarding your health or medical conditions. We hope you have fun listening to us today, and we'll see you next time at the Nurses Station.